Good morning, everyone. We'll go ahead and get started. It's 11 o'clock. This is the Rock County Public Health Department media briefing for May 27th. This is live streamed on the Rock County Public Health Department Facebook page, and the recordings are available afterwards on our Facebook page and our YouTube channel. So we start with some information from the Rock County Public Health Department, and then we open it up to any questions from any participating media. And I just want to introduce myself. My name is Jessica Turner. I am the Communications Specialist for the Rock County Public Health Department. And with me today, we have Nick Zupan, Epidemiologist, Katrina Harwood, Health Officer, and Felicia Martinez, Public Health Nurse. So with that, we'll go ahead and get started. I will turn it over now to Nick for some data updates.
Thanks, Jessica. So just to highlight some of the COVID activity that we have been seeing over the last week, we are still seeing ongoing decreases in our COVID case activity. So right now we have 16,312 Rock County residents who have tested positive for COVID-19 over the course of the pandemic. And since last week, this is an increase of just over 100 additional cases being reported to the health department. Right now, we're averaging about 15 new cases per day over the last 7 days. And our active case numbers have fallen pretty significantly since last week. We're now looking at about 277 active cases. Last week, we had about 100 more active cases that we were following up on. So those numbers are all looking pretty good. We have 175 deaths due to COVID. So this would be one additional death being reported to the health department since last week. And most recent counts of our hospitalized patient numbers, we had 7 patients in the hospital getting care for COVID-19 on Tuesday. And then in terms of our vaccination rates, we have 44% of the Rock County population having received at least one dose of the COVID-19 vaccine, and 38% of the county population having completed the vaccine series. And I wanted to share a little bit of additional information this morning on our call. We've been looking into data related to cases in the vaccinated population, just to get a sense of how effective the vaccine is at preventing cases of COVID-19. So when we look at unvaccinated individuals and how many people have not been vaccinated yet and how many cases are among unvaccinated individuals, we have about 1 in 6 unvaccinated Rock County residents having gotten COVID over the course of the pandemic. By comparison, when we look at those who have received at least one dose of the vaccine, the proportion drops significantly. So about 1 in 700 individuals who have received the first dose of the vaccine have gotten COVID-19. And in terms of those who are fully vaccinated, about 1 in 2,000 fully vaccinated individuals in Rock County have gotten COVID-19. So just looking at this data alone, it really shows the effectiveness and the importance of getting vaccinated. So that's all the data that I wanted to share this morning. I'm going to turn it back over to you, Jessica.
Thank you, Nick. I will now turn over to Katrina for some additional information.
Thank you, Jessica. On Tuesday, the biotech company Moderna stated that their COVID-19 vaccine is 100% effective against COVID-19 among children 12 to 17 years of age. After a lengthy study, Moderna found no major safety concerns and said headaches, fatigue, and chills were the most common side effects of the vaccine. Similar to Pfizer, they plan to seek FDA authorization to have the vaccine available to children as young as 12 years of age. And we will continue to keep everyone posted as we learn more. As a reminder, the DHS community-based vaccination clinic in Rock County, located at Black Hawk Technical College, is collaborating with Rock County Public Health Department to offer dedicated blocks of time to local employers and organizations to offer employees and members the opportunity to get vaccinated. Interested employers or organizations can email their contact information to covid19.questions@co.rock.wi.us to receive more information. The community vaccine clinic at Black Hawk Technical College is free, no insurance is needed, and no appointment is needed. We also want to remind everyone that people who are unable to leave their home to receive a vaccine can receive a vaccine in their home through a partnership between the City of Janesville and the Rock County Public Health Department. Anyone who is homebound and lives in the Janesville Fire and EMS area is eligible for this service. Caretakers of people who are homebound can also be vaccinated at the same time. If people are interested in this opportunity, they can call 608-352-6726 to schedule an appointment. The goal of the community clinics and program to reach people who are homebound is to increase access to vaccines for all Rock County residents, including people who may not have access to other vaccine providers. We want to ensure every individual interested in getting vaccinated has an opportunity to do so. Going forward, we will continue to seek out partnerships like these so that we can continue to increase the percentage of Rock County residents who are fully vaccinated. While we are continuing to make progress, we do ask that people who are not yet fully vaccinated continue to wear masks when indoors and with others outside of their household. I will turn it back to Jessica.
Thanks, Katrina. Now we'll have Felicia give some more information about some clinics that are taking place in the community.
Good morning. So to help increase access to vaccinations, as well as the percentage of vaccinated individuals in Rock County communities, we've been partnering with local schools and pharmacies. We held clinics at Evansville High School on May 18th, Milton High School on May 19th, Edgerton High School on May 20th, and Orfordville's Parkview High School on May 26th. Turnout was good, with approximately 200 individuals receiving their first vaccine dose at each event. Evansville was able to administer 251 doses of the vaccine. Milton administered 176 doses of the vaccine, and Edgerton was able to administer 203 doses of the vaccine. We have some upcoming clinics as well. Today, anyone 12 years of age and older can visit Clinton High School from 2 to 5 p.m. for their first dose, with second doses being provided on June 17th. Walk-ins are welcome. Parking is available in the north parking lot with entrance via door C31. Minors should be accompanied by a parent or guardian, but if that is not possible, a consent form is available. Please see the Rock County Public Health Department Facebook event for the link to the consent form, as well as a registration link. If you have any questions, please call 262-379-9326. Also going on today at the Blight Public Library is an event from 5 p.m. to 7 p.m. in the community room on the first floor. Walk-ins are welcome. They are administering the Moderna vaccine at this clinic. The second dose will be administered on June 24th from 5 to 7 p.m. in the same location. If you have any questions about the Blight Public Library event, please call 608-364-5711. We've also partnered with Walgreens to help increase access to the underserved. Together, we will be hosting a vaccination clinic at Blight Head Start this Sunday, May 30th from 10 a.m. to 2 p.m. Head Start is located at 1221 Henry Avenue in Beloit. This clinic is open to anyone who has not yet received a COVID-19 vaccine or is in need of a second dose of the Pfizer or Moderna vaccine. This clinic will offer all three vaccines, Pfizer, Moderna, and Johnson & Johnson. Walgreens will be providing a $5 coupon to anyone getting vaccinated at this clinic. Minors must be accompanied by a parent or guardian. For Pfizer and Moderna vaccines, a second dose clinic is not yet scheduled, but second doses can be scheduled at any area Walgreens store. Those who wish to avoid having to schedule a second dose may opt for the single shot Johnson & Johnson vaccine. Please see our Rock County Public Health Department Facebook event for the registration link. And if you have any questions, please call 608-352-6727. As with nearly all the community clinics, walk-ins are welcome, and we appreciate our media partners and community members sharing these opportunities widely. Every new vaccinated individual makes a difference. And then also to kind of reiterate some of the homebound vaccination Yeah, we also want to reiterate that Janesville is now vaccinating people who are homebound. Anyone who is homebound and lives in the Janesville fire and EMS area is eligible for this service. Oh, some of the stuff there. Okay, I think that was everything. Thank you.
Great, thank you, Felicia. That concludes the Public Health Department remarks, so we will now open it up to the media for questions. Looks like we have one attendee today. So we have Austin from Blight Daily News. We will just give you the ability to mute and unmute yourself, Austin, and you can ask any questions that you have. So go ahead. Just a reminder, on the phone to mute and unmute is *6. Do we have any questions today, Austin? Okay, not hearing anything from Austin. I thought I saw his hand raised, but must not have any questions today. So that will, oh, there we go, Austin. Did you have any questions?
Guys. Yeah, I only have a couple today, just two for Nick, I think. Just wanted to kind of hone in on those breakthrough cases. I know that last week Nick was able to provide like an overall number. I think having that breakdown is really important, so we'll be able to mention that. But just wanted to get an overall number if that's available. And then also the second part of my question, we're seeing right now the DHS vaccine data shows that 17% of people ages 12 to 15 have received at least one dose in Rock County. Is that number kind of consistent with what the health department was anticipating, or is that number low or higher than expected? Just wanted to get some feedback from you guys on that. Thank you.
Sure. So I can answer the question in terms of the breakthrough cases. We have gotten a little bit of additional information from the state since our last media briefing last week. So I did look into the numbers a little bit more specifically. So over the course of the pandemic, since the vaccine has been available, there have been 33 what we would call breakthrough cases. So these are cases among people who have been fully vaccinated, and also it's been 14 days since their final dose of the vaccine. So when we look at that number, it's fairly consistent in terms of the rate of breakthrough cases that we may see based on the state averages. I think it's about 0.003% or something like that, and it's very consistent with the state numbers of breakthrough cases that they've seen across the state among fully vaccinated individuals. So the time frame now is a little bit longer than the number I'd reported last week. So this is over the course of the vaccination period that we're looking at, and not just through the end of April, which was the number that I provided last week. And in terms of our vaccination rates among our 12 to 15-year-olds, this morning we're at 17.7% of 12 to 15-year-olds having received their first dose of the vaccine. That's very consistent with the state numbers that we've seen so far. I think we're encouraged by the kind of the uptake that we've seen among our 12 to 15-year-old population. The easiest way we get through the pandemic is get as many people vaccinated as quickly as possible. The 12 to 15-year-old population has not been eligible for very long, a few weeks here, and we're already seeing about nearly 1 in 5 12 to 15-year-olds in Rock County having received that first dose of the vaccine. So it's encouraging to see those numbers continue to increase, and we're doing our best to make the vaccine available in these school-based clinics. So hopefully we see that number continue throughout the summer and start to see the numbers of kids being fully vaccinated increase as well.
Great, thank you. Thank you for the question, Austin. Do you have any other questions for us?
Nope, no more questions. Those were the only two. Thanks, guys.
Great, thanks, Austin. So that will conclude our media briefing for today. So I want to thank Austin for participating and thank everybody who's been watching on the live stream on our Facebook page. We are going to be moving these briefings to every other week rather than every week. So just so that everybody's aware, we will not be having a media briefing next week, but tune in the following week and we will see you there. If anybody from the media is interested in attending, please send an email to media.publichealth@co.rock.wi.us, and we can send you the information to participate and be able to ask questions live. So we will see you guys in 2 weeks, and thank you, everybody. We will look forward to seeing you. Be healthy and be well.